This conference will now be recorded.
Thank you for joining us today. We have Nancy Ruffner with us. And Nancy is a board certified patient advocate and founder and owner of Navigate NC, a consultancy that helps persons navigate the challenges of change, whether medical, legal, financial, or more. Nancy's passion in business and in personal life has always been to work on behalf of marginalized populations or for those who may not have a strong voice, assisting her own parents in navigating the challenges that normally come with aging, unveiled the gaping business and societal need. A complex healthcare system, a rising elderly population, and the difficulty of long-distance caregiving are producing tremendous challenges, one that Nancy works to remedy. Because a big part of Nancy's focus is community education and outreach, she became a certified Campaign Zero educator. Nancy will teach you ways that you as a consumer can advocate for yourself and someone you love. We're pleased to have Nancy join us today to share in this presentation about how to prepare and participate in your telehealth appointment. I'm going to turn it over to Nancy, and thank you so much for being with us.
Thank you, Kimberly. I'm very, very pleased to be here, especially with this important topic. As Kimberly mentioned, I'm Nancy Ruffner. I'm a board certified patient advocate, but I'm also a speaker, a consultant, and a coach. I do own a patient advocacy and care management agency named Navigate NC, and we're helping people to navigate all kinds of change these days. And we do it inside a healthcare system that's not showing any signs of getting any easier. So our very interesting and timely topic today is telehealth. I'd like to share some information at first, and we have built in some time for questions and answers and discussion if needed. If folks have any questions, just hold them to the end, and we're happy to get to them all. I'd advise you here, a lot of folks choose to take notes during my presentation. So if you've not already got your pad and pen ready, go ahead and secure that, because in a little bit, I'm going to have you be mentioning a lot of things that you may want to jot down. To illustrate telehealth and what we're talking about today, I always like to start out with a case study, a real client that I've assisted. I want to tell you about John Rogers. Of course, the name's changed. John is 69, and he's a patient who has really embraced telehealth. He has several chronic conditions, including chronic obstructive pulmonary disease, or COPD, and he's got chronic pain from a spinal issue. So when his COPD flared up, he found himself kind of gasping for breath, and he wanted to try telemedicine instead of risking an office visit. And he was very relieved to find out that he could skip the risky trip to the doctor's office, especially during COVID-19. John also understands that he is in the at-risk category, that he's vulnerable. And he said to me one day, you know, you watch on TV there, and there's 6 different categories of COVID-19 risk, and I have 5 of them. So we talked about how we could make a virtual visit happen. And John was as surprised as anybody. All he had to do was make an appointment with his medical office, and it became for him as simple as clicking on a link that he received from the doctor's clinic. Using his own smartphone, John was able to pull up a tiny picture of the doctor on his screen, and the practitioner was able to see him as well. And it was different than what he was used to. That day, he didn't see his regular doctor, but it was a doctor in the same practice group. So in this instance, I was there with John as his care partner, and I kind of on standby as coach if needed. But my main job was care partner and acting as a scribe. So the doctor comes into the meeting room, and he had looked over John's chart, and he was up to speed, and he was ready to help. After some questions and answers, he prescribed John a round of antibiotics. And that medication helped at first, but a couple of weeks later, John felt like he needed to reach out once more and be seen. So we were actually able to speak with the same doctor in the second visit, and that doctor just tweaked the medication regimen, and John was fine. So let's learn a little bit more about telehealth. Let's break down what it is and how it came to be and how we can profit from it. Telehealth is sometimes used interchangeably with the word telemedicine. You hear one, telemedicine, telehealth, they're largely the same. Telehealth usually refers to a real-time interaction, when you're interacting with another person, but it can also mean remote monitoring, like sometimes folks will send their glucose readings on through to a provider. As far as how telehealth came to be and its history, well, Wikipedia claims that the earliest telehealth encounter can be traced all the way back to Alexander Graham Bell in 1876. Alexander Graham Bell was actually using his early telephone to get help from Mr. Watson because he had spilled acid on his trousers. Soon after that, the first medical documentation of telemedicine was in The Lancet in 1879. The Lancet is a well-known medical journal, and it's still in existence today. More recently, telehealth came about in our lifetime in the 60s. We used it to monitor our astronauts in space. Telemedicine capabilities were built right into the spacecraft and right into the very first space suits. In the 1980s, Texas and Florida started experimenting with primitive telehealth in its prison system. And it turns out that North Carolina was an early adopter of modern telehealth also. In the 1990s is when I first found out about telehealth. I read an article about this thing called telemedicine, and I was struck by the fact that it was already in use by the North Carolina Department of Corrections. It was being used in our prison system. You could have knocked me over with a feather. What I read about was a prisoner, a patient in Burgaw, down east, Burgaw, North Carolina, needed to see a neurologist. And there was a neurologist seated in Central Prison in Raleigh, North Carolina, who was making telephonic and video visits with prisoners all across our state. And I read about this interaction. What normally would have had to have happened in those days and before was that the prisoner would have had to have been loaded up into the prison van with a prison driver and a prison guard, and the three of them would have had to journey into Raleigh to make this appointment happen. It would have taken the staff and the patient, it was pretty much a day trip, but it would have taken a lot of people off of their regular duties, and it was expensive to the state. So when I read about that, one person with the ability to see several in the course of a day and no travel, I thought, yeah, this could mean real reform. Look at this patient access. This is going to be some cost savings. This is terrific stuff. So I became more interested in telemedicine, telehealth. By the early 2000s, we were starting to see some universities teaching telehealth and in their public health. Campbell University was thinking I think it was 2009, they were thinking about having a master's program of school public health. And they wanted to be able to focus on reaching rural parts of our state with their curriculum and their graduates. And they were holding some informational sessions. So I jumped in the car and went down there, and they were kind of having a town hall meeting and talking about what are people interested in. This is what we think the school will look like, and this is what I think we can bring to you. And my hand shot up, and I asked, are you going to talk about telehealth? Is there going to be telemedicine? Are you going to be able to do this? And in 2009, they looked at me kind of funny when I brought that up. But now we can see today that telehealth is baked right into their curriculum and that of many universities, and that telehealth is much more widely accepted and certainly part of the educational process. Beginning in the 1910s, we started seeing smart telehealth technologies. We saw the advance of health and wellness devices, software. This industry was and is still blowing up. Both healthcare organizations and the general public are introducing or adopting self-tracking methods and cloud-based technologies. I mean, you and I are signing up for apps. Even today, a TV commercial tells us that Noom, an app named Noom, is going to help us lose weight. So we download it. We're counting our steps using Fitbits, but now those Fitbits can do so much more. We have falls prediction that's built right into those medical alert devices that we wear as necklaces or as wristbands, and our smart watches. iWatch, the iWatch was the first one to come out with this, that can predict that a fall is likely. And we have smart carpet and smart shoes that actually get to know our regular gait, and when something is amiss, it can signal that a fall may occur. It's amazing, the advance of this technology. And that brings us to COVID-19 and the boon that telehealth has been. It's become unsafe for a lot of us to go in to the doctor or into the ER. Well, problem solved. Telehealth allows physicians to reach more patients, and it limits our exposure to the virus. If you would, I'm on slide 2. So with regular healthcare costs rising, it makes sense that we look at ways to contain the cost of healthcare service delivery. Service delivery means how we get the services out to the general public, how providers see their patients. In addition, with Medicare and the VA populations being such large segments of our society, our government has been looking into telehealth for years, because there's an awful lot of benefits to telehealth, besides the one that I've already mentioned. Both the patient and the healthcare system stands to benefit. Today, we have portals or accounts we can set up, and we can communicate with our doctor or our nurse through these portals. We can request prescription refills. We can review, pardon me, we can review test results and summaries of a previous visit. We can look at our notes. We can schedule appointments, and we can even sign ourselves up for appointment reminders. Telehealth is also preferable for patients who have limited mobility. For instance, those with movement disorders or neurological diseases that make movement and transport difficult, like somebody with Parkinson's or MS. And telehealth may also be preferable for anybody that has an ordeal, that has to go through an ordeal to access care. It's a benefit also to folks who support those patients, like a family member having to get off of work. It's not as much time off of work, transportation, ordeal. And so telehealth improves our access to healthcare just as much as it improves the provider's reach out to the public. Think about people in North Carolina's outlying rural areas. This telehealth enables them to see a provider. So, for example, if you're in Pender County to the east, or you're in Yancey County to the west, they don't have any specialists in those counties. And so it makes sense that we can connect them to somebody to provide those services. They can be seen. This is very akin to another state. Think about Alaska, where they've been using video for years, not only for healthcare, they use it for their court system. In Alaska, you go to court by video because they have to fly between cities. And so their reach is for the court system and the medical system. So what telehealth does is solves the impossibility of service delivery. It also helps curb costs, rising costs to healthcare. Since 2010, North Carolina has shuttered 6 hospitals. And so costs have been rising, and we've been working to contain those. All before COVID was ever heard of. Our costs are really out of control now. But when you think about it, North Carolina still has counties that don't have a doctor, much less specialists. But that's another medical and social ill for another presentation. We touched on before that telehealth also saves time and travel costs. Think time, travel, time away from work, what time away from home, what that means for both the patient and their care partner. It minimizes risk and exposure, especially during COVID and overall upheaval. So for the most part, consumers who are using telehealth love it. They don't have to drive. They don't have to find a parking deck and navigate that and walk. And they don't have to go through all the hassle to see a doctor. But telehealth is not without its challenges. There are still some challenges to consider. Tech challenges is one of them. You know, bad weather affects our connectivity. If our power goes out, our bandwidth might be affected. Low bandwidth, because now more people are on the internet, especially during business hours because they're working from home. And we've got more users lately, and that slows the bandwidth. Another challenge is the literacy or illiteracy of the users. Folks that don't know how to, that are not tech savvy, don't know how to use. We're all in the same boat. The providers are right here with us. Everybody's learning, and that's why we're here today. Another challenge is that there can be a loss of personal connection. You know, as patients, if I'm talking to you online, video or phone, I kind of have to go overboard to hear and to be heard. The providers have to do the same thing to make sure that that good connection is made. It's really hard to handle a difficult or tender conversation over the phone. I think we're both trying harder here, though, to bridge that gap. Telehealth may not be suitable for all needs. Obviously, there's some things that still must occur, lab tests and swabs and x-rays still has to go on. You know, whether you need an MRI or a CAT scan or just a simple injection, some things still need to be done in person. Telehealth can pose threats to our privacy. There are some challenges that we have in place. For instance, medical licensing, state-to-state licensing, or insurance reimbursement. If I'm a provider and I see a patient and we're in different states, then it's difficult to know which laws are actually in control. Also, it opens up the door for error in billing or insurance. And so there's some procedures that need to be ironed out, and we're doing that now. Another challenge is establishing continuity of care. If I have a patient and he sees several providers, then I have to make sure that that telehealth provider knows about the other providers. Not only knowing what kind of care that they're providing, but especially if they're prescribing. If I've got 5 different doctors prescribing to my patient, then I need to make sure that everybody knows what everybody else is doing, because we all know how medications can fight and can cause interactions and can actually can interfere with treatment. So my job as a patient advocate is always making sure that one hand knows what the other is doing. And this may silo us, and that telehealth provider may not know about the other. So again, we have to go overboard just to make sure that the information is shared. And I think another challenge is that we all may need some new equipment or updated equipment or better internet access. And we have to think about how that affects us as patients, or how it affects the providers. And right after that is, how will that affect our pocketbooks if we have to invest in something new? One important word about security. If you use a telehealth website, it may not be secure. The information exchange, your information doesn't have the same protection as the information that you would give to that healthcare provider if you were face-to-face sitting in their room, or if you were using their secure portal. So just be aware that the information that you may share on a retail site like Teledoc can be accessed by third-party users. They may allow information to be collected and sold to others. And maybe it's not about your exact diagnosis. John Jones has this ailment, but they're trying to capture who's using telehealth, what kind of demographics, what age groups are accessing telehealth, or where are they? Where's the need? What are the reasons for seeking care? Like we have a lot of people that have pulmonary issues, or blood pressure's the thing in this particular region. So hopefully this information is being captured and collected, and yes, sold to determine needs, to see how to prepare for this service delivery or to help staff. But one has to wonder, and the patient advocate in me has to wonder, what if they are they, I'm saying this in quotations, they, what if they're capturing the number of times you use telehealth providers and what you use it for? So it may be very hard to put this genie back in the bottle once COVID-19 is over. And I think it's important that we just know and weigh that the information doesn't have the same protection that you would have if you were in the room with that provider or on their portal. It's much more secure if you're on their portal. So, we know that COVID-19 has caused a lot of regulations to be relaxed so that we could enable service delivery, so that folks could reach doctors, and that we ourselves have had to use less secure means. I've used Skype and FaceTime more, and there is just not a lot of protection on there. And so my advice is to just be aware of that and use your best judgment for your own situation. So let's get ready for the telehealth appointment. If you've never used telehealth, if you've never had an appointment by video or a telephone call, it may feel a little strange until you get used to it. But what you're going to find is that much of what occurs is actually the same questions, the same people, the same reason for being there. It's the exchange or the delivery of services that's different. And like many other medical appointments, things are going to go a lot more smoothly if we just take a little time to prepare for this meeting. So here's what you can do to prepare for the call and execute the appointment and then debrief. Slide 3, please. Folks may want to get out your pen and paper here because I'm about to rattle off some things that you can do to help prepare yourself. It's just as important to do this preparation for a telehealth appointment as it is to prepare for a face-to-face encounter. As we go through this today, you'll keep finding that a lot of this process is the same or very similar in nature. The first thing you need to have ready is your insurance coverage information. Have your insurance card. Right now, during COVID-19, Medicare and Medicaid are covering the cost of telehealth appointments. Many private insurers are following suit, and you're probably getting notified about that you may access telehealth. Check with your insurance provider or Medicare.gov if you're not sure. I've also encountered folks who at this time just didn't have a primary care physician, but they still needed to talk to somebody. They needed to be seen, or they needed urgent care. And you can get help through virtual or retail health provider like Doctors on Demand or Teledoc. I'll send these links. I'll arrange with Kim if possible to send an email to everybody that's on this call so that you'll have these links and these resources that I'm talking about now and on in further into the presentation. But Doctors on Demand and Teledoc, the retail providers, may not be accepting original Medicare, but they may be covered by private insurers. I know I looked into mine, and if it was COVID-19 related, the door was wide open. If it was something that was not COVID-19 related, my private insurer said you'll still need to be prepared for to offer a copay. I think the most important thing you can do is to prepare a symptom diary. Well, what's a symptom diary? Well, that's just some jots about what your symptoms were before you decided you needed this appointment. What was going on? How long had you had these symptoms? What did you try to feel better? Did it work? What didn't work? Um, and I have a personal example here. I had the flu, some kind of flu, during the first week of March 2020, just as the coronavirus was beginning to surface in the United States. And so I kept a running diary on a legal pad of the date and time that I was taking my temperature, because it was fluctuating. I wrote down whether or not I took any kind of analgesic, ibuprofen or Tylenol, and how much I took, the dosage. I was also writing down other symptoms, whether or not I had appetite, did I have a cough, was it a productive cough, and whether I was experiencing any shortness of breath. And being able to give that information to my doctor over the phone at that point, that helped him to provide my care. It helped him to make a recommendation as to what I needed to do next. A lot of folks keep a symptom diary, or at least keep logs. A lot of folks log their blood pressure. That's a common. Also recommended is to take pictures if you think that you have a symptom that needs to be observed. A lot of portals, retail and your medical groups portal, will allow you to upload a photo. So think rash or swelling. If you have something you need to show that provider, take a picture of it. Also, in the day of your appointment, give some thought to your clothing. And you likely already do this for a face-to-face appointment. If you think there's something you're going to have to show a provider, any parts of you, and again, we're thinking swollen area, swollen ankles, a rash somewhere, make sure that you can easily display this if you're in a telehealth appointment. Make it easy on yourself. Be able to roll up your sleeve or show parts of a limb. Just give some thought to your clothing, loose clothing that'll allow you to show the medical provider what's concerning you. And that's very much like a face-to-face meeting. Okay, you're going to need to have your insurance card, your credit card, because there may be a need for a copay, the list of symptoms that you're already presenting that prompted this appointment. You can pull from that symptom diary. Be ready to say, here's my concern, these are my symptoms, here's when it started. And you likely already have this in your symptom diary, but have it jotted down so that you can easily share that with your provider. Also, be ready with your relevant medical history, including any chronic conditions. Basically, you want to be able to easily relay anything that could affect the doctor's decision-making or recommendations. Remember that the provider that you're seeing may not have all your records in front of them. This may not be your primary care provider. It might be somebody in the medical group, or it might be somebody completely new. So be ready to summarize your major or your recent diagnoses, your most recent hospitalization. They always ask about the most recent hospitalization, and any recent test results too may be relevant. You'll want to have a list of all your prescriptions and medications and the dosages. And all your prescriptions and dosages also includes over-the-counter medications that you might take, herbal supplements, including vitamins. It's basically, we need to be able to tell the provider anything that we introduce into our body. And this could be a medication. It could be an ocular solution, eye drops. It could be nasal sprays. It could be a topical cream or an ointment. And you may want to also say, this is something new that I've been taking. I just started taking this last week. Or we just discontinued this because it wasn't sitting well. So new or discontinued is important as well. Also have the your pharmacy's phone number and address. There's an awful lot of locations of Walgreens and CVS, and if that physician is going to prescribe something for you, you'll want to have that information handy so you can tell them which location and their phone number. Also have your primary doctor's name and contact information as well, because remember, you may not be seeing your primary care physician, and this provider that you're online with or on the phone with may want to communicate or send records to your primary care. So we're going to slide 4, please. Now it's time to prepare your care partner. We've prepared ourselves a little bit. Now we're going to talk a moment about the person that we want to help. Have somebody available to listen to the call and perhaps be there with you. I refer to this as care partner. That person who's serving as care partner can take notes. That way you can focus on the appointment, the discussion, the interaction, and somebody can act as your scribe. That same care partner might also think of something that you've forgotten, left out, and so talk to that care partner. There's a possibility that they may get called into the discussion, and I know you'll remind them that they need to be careful of the time, because these are always short appointments. Just like a face-to-face always seems to go way too fast. You'll want to prepare your tools for the appointment and your technology. So when you're able, use the camera on your phone, your laptop, or your tablet. Your appearance in a live picture can give that provider such good information, additional information. And nobody cares if your hair's a mess or what you're wearing. Focus on being able to convey your condition. Plug in your tools or have everything charged up in advance. You don't want to drop the call in the middle of your appointment. So plug in and charge up. Consider using a second telephone to record the call. Maybe your care partner offers up their telephone and they switch it on to recording, and they can capture the entire exchange. Now, your care partner is going to want to practice turning the recording on and off so that it's a smooth switch on off when the appointment begins. Please go to slide 5. Just before your appointment starts, take a moment to collect your thoughts. Remember that everybody has their first time using telehealth, and that's on both ends of the call. It's safe to say that many of us are learning and using these new skills right now, and so it's going to be okay if you fumble a little bit. But as you can see, there's much that we can do right now to be ready for that exchange. Here's one that'll sound familiar to you. Be prepared to wait. I'm smiling now. You may be placed in a digital waiting room before the session begins, before the doctor enters. And that's very much like face-to-face, the waiting room. I've literally been with people as a care partner who, while they waited for the doctor to enter the electronic room, they were leafing through a magazine, just like if they had been at their doctor's office. And you know this next part too. Be aware of the time. Keep it short in the appointment. Time is of the essence inside every medical appointment. Somewhere between 7 and 11 minutes are the averages. So now's not the time to rattle off your medical history. You're going to draw from your ready information, and you're going to answer questions. And yeah, you may be asked to stick out your tongue and say, ah. If you're unclear what the provider has asked or has said to you, it's perfectly okay to ask them to repeat what they said. I use this technique that's referred to as talk back, and it basically means that you say back to that provider what they just said to you. And so, for instance, if a doctor tells, they're writing me a prescription and they're telling me how to use this prescription and it goes really fast, I may say something like this. So I'm supposed to take this medication once a day with food, or I take this new medication at bedtime, right? If you still don't understand, it's okay to ask that provider to say it another way, to rephrase it. Sometimes I just say, hey, I want to be sure I get this. Would you please explain it to me another way? And the provider will. Also, in this scenario, your care partner is your backup. Remember, you're the primary and you're having the exchange and the dialogue, but your care partner may signal you that they need to ask a question or gain a little clarification. At the conclusion of your appointment, this is really important, find out what to do if you think of questions after your appointment. What if you think of something? Who do you call? Do you email someone? The nurse? How do you get more information? Or will somebody be following up with you? If you go to slide 6, please. We're in the debrief section right after the appointment. The first thing you do after your telehealth appointment is stop. Stop right then. Jot down some notes. What just happened? What did they ask? What did you answer? What were you told to do? Then debrief with your care partner. Compare notes. Replay that recording if you made a recording on an extra cell phone. Make sure that you're clear on what action is required on your part. What do you got to do? What comes next? If your provider said that they were going to phone in a medication, if you have a prescription, they were going to phone it in, wait just a little while and then call the pharmacy that you gave them to make sure that they got the order. And that's an excellent time to find out, when will my prescription be ready? And how do I pick it up? There are a lot of pharmacies with varying processes now relevant to prescription and picking up prescription. So find out what their COVID-19 process is, or maybe delivery is available, or perhaps you can have another person go by and pick that up for you. Ask those questions. And then you'll want to store your captured information. We're going to document every telehealth appointment, just like there's going to be another one coming. So combine any information that you captured for your own benefit. Ask that care partner to share their notes, add in your additional jots and your symptom diary, and create a file. And that'll be the record for your encounter. Now, make sure to write down the date and anybody that was present to help jog your memory. And slide 7, please. If you hadn't gotten around to it, if you haven't already done so, it might be a good time to set up electronic portals with your providers. You'll want to set up an account with your doctor or medical group and also your hospital system. For example, I may have a patient portal at Acme Family Medicine, but I also may have one at UNC. Sometimes that's one and the same because my family medicine doctor is part of UNC. So sometimes the medical group and the hospital is one and the same. And communicating through a portal right now, well, it was already the preferred method with lots of medical practice, even before the pandemic. But now it's an even more important that we have a way to communicate with our medical providers. We can track and they can track and respond to your questions and give you prompts and deliver information for your guidance as well. You could ask questions in an online account, and it can be faster or less frustrating than hanging around on hold on the phone or waiting for a call back. We're all familiar with those kinds of recordings that we encounter. Leave your message and it will be responded to by after 4 o'clock today, or those kinds of messages. That can all be eliminated if you use your online portal. So in the same spirit, you'll want to go ahead and set up an online account with your insurance company. This includes getting to know the Medicare website and maybe any supplemental insurance companies. You may have Aetna, United, whoever your insurer is. go ahead and set up that information, those accounts, because what I want you to do is get familiar with navigation. Nose around that website. Find out where to go to ask questions. How do you do that? Do they have a frequently asked questions page? You can learn a lot by reading that. One example that I give when I teach about this, I tell folks to select a medication, yours or someone else's, and then go online to your insurer and see if you can find if that medication is covered under their plan. And so I give that out as an exact assignment for folks to do so that they are forced to nose around and look, navigate their insurance. It'll save you a lot of time and angst, and if you know where to go to get the answers to your questions. It's really, really important to realize that right now, insurance companies, especially Medicare, they're making significant policy changes now that affect us, affect all of us during the pandemic. So we have to stay abreast of those, and we do that by becoming savvy consumers and learning how to look this information up. And the change is still occurring, and more will come during and after the pandemic. So we should learn it now. If you have any questions or you need help to contact your provider, take a look at their website. And maybe you can get some assistance through some of their customer service staff if they're a larger group. You may want to consider the services of a patient advocate or a care manager to help you. I can teach folks how to locate a patient advocate, by the way, anywhere in the United States. What's more, my company also will teach you how the questions that you need to ask of us. We have a free download on our website that's called How to Interview and Select a Patient Advocate. And folks will read that so that they know what questions to ask of us. Now, I always say, you don't have to hire us, but whomever you hire, get those questions answered to your satisfaction. Slide 8, please. Resources and finding out more. Well, if you need more information, your insurer is a good first call. Chances are they're fielding a lot of questions that are similar to your questions right now, especially during COVID-19. Take a look at their site, call their customer service line if you need to. Usually, I will caution against consulting Dr. Google. I usually will say, don't Google for information about a diagnosis. I recommend sticking with the winners for big-time medical information like the CDC or Johns Hopkins or the Mayo Clinic. But for this topic, telehealth, telemedicine, and how to plan and prepare for, I've relaxed my advice. I think there's a lot of good telehealth information online. The North Carolina Department of Health and Human Services, that NCDHHS you see right there, our state's Health and Human Services website has an excellent section on consumer telehealth resources. And they also address seeking mental health services as well. And there's video. So you may, and we'll make sure that you get that link after this presentation. Another good source for telehealth information on the part of the consumer is AARP. They have some great articles, a lot of them. And all you need to do is pull up the AARP website, go into the search box, and just type telehealth. It will render a lot of helpful articles for you. So I'll get that information into you. I usually do a follow-up email for attendees that includes tips and articles and the links that we've talked about. If you like this kind of information, healthcare navigation, patient safety information, then you may want to follow Navigate NC's Facebook page or read our blog. Well, the best thing that you can do is join our VIP email list, and that'll let you know. You'll be the first to read the blogs. You'll know about presentations and events like this one. I just launched one last week. It'll be 8 weeks and then another 8 weeks, a series called Need to Know, and that provides valuable information and connects you to all kinds of professionals in the region. And it has a Facebook group too, so that you can interact with different presenters and providers and professionals and among yourselves in the Facebook group. So there's a lot of ways to connect to good information. So in summary today, I hope that you have learned that so much of telehealth is the same as what we already know. If we take the time to prepare, we're going to get a lot more out of the appointment. We also are reminded that the short length of the appointment is the same. Be ready to be brief. You're going to be asked for your insurance card or possibly a copay, just as if you had entered into a building and or walked right up to the registration desk. The questions are the same. The doctor's going to appear. They're going to ask you questions, and they're going to help you. And our job is to be able to relay our symptoms, tell our meds, and what our chief complaint is. The doctor will then diagnose and prescribe or treat you. And then our job is to remember what the provider said and to take action on that. So if you remember anything that I've talked about today, please remember these points. Telehealth is very much akin to a face-to-face in terms of process. We've learned that today. We are reminded that the appointment will be brief and focused. This is all doable. This telehealth may be new to you, but it's likely new to your provider as well. When you think about it, we all have to learn how to tie a shoe or ride a bike or use a cell phone, and we're going to learn this too. But the biggest takeaway that I can give you and any participant in this presentation is that we can be active participants in our own healthcare. With a little preparation, we can get our needs met. A little preparation goes an awful long way. And slide 9, please. I want to thank you for being here with me and the opportunity for us to be together. We've built in some time for question and answer at this portion of the presentation. I will follow up with an email if allowed and provide you with links and additional tip sheets and interesting articles. And so I'd like to open up the floor to any questions if anyone has any.
Thank you so much, Nancy, for such an informative presentation today.
You're quite welcome.
I'm going to stop the recording at this time, and that way the questions would be off the recording.
Okay.